Hi, I'm Kayla, and welcome to Kayla Tailored Wellness. I am a family nurse practitioner that specializes in integrative medicine. So what that means is that not only do I get to care for patients traditionally in the healthcare clinic, but I also get to provide disease prevention, education on lifestyle changes, and treat conditions with vitamins, supplements, and herbs. So just remember, I am not your healthcare provider. I do not know your allergies. I do not know the medications you are taking. I do not know your past medical history. So use the information you learned today to have an educated conversation with your healthcare provider. So today I want to discuss what insomnia is, what causes insomnia, how I would treat insomnia pharmacologically in the clinic, lifestyle ways to prevent insomnia, and natural ways to treat insomnia. But first, smash that like button and hit the subscribe button for the YouTube algorithm. Insomnia is a sleep disorder that makes it difficult to fall asleep, and when you do fall asleep, you may wake up throughout the night or wake up early and not be able to fall back asleep. And then this causes you to feel tired throughout the day. Insomnia can be caused by jet lag, so traveling from a different time zone, intaking alcohol, tobacco, or caffeine before bed, taking a nap during the day, not going to bed at the same time every night, problems such as pregnancy, pain, or even an enlarged prostate that makes you urinate frequently throughout the night, medications such as inhalers or weight loss medications that cause increased heart rate, and mental health conditions such as anxiety, depression, or stress. When a patient comes to the clinic and they're having difficulty with sleep, I'm going to further ask questions. I want to know, when you lay down for bed, how long does it take you to fall asleep? Once you are asleep, how many times in the night do you wake up? And then what time do you wake up in the morning? So I want to have an idea of how many hours you slept throughout the night. I'm going to assess how the lack of sleep affects them during the day. Does it cause irritability? Do they have trouble concentrating? Do they fall asleep reading? I may consider a sleep study to rule out sleep apnea, or I may work up their thyroid, as hyperthyroidism can cause insomnia. In the clinic, I'm going to try slightly sedating medications first, such as Benadryl or hydroxyzine. If that doesn't work, I may try some mental health medications such as trazodone, Remeron, or Seroquel. I may consider clonidine, which is actually used for blood pressure but has a sedating effect. Even benzodiazepines such as Ativan, Xanax, or Valium, and hypnotics such as Ambien or Lunesta, but these can create dependence and tolerance. Lifestyle ways to treat insomnia include no naps, going to bed at the same time every night, using the bed only for sleep and sex, no eating or hanging out in bed. Eliminate flashing lights such as from the television or from your phone, as that stimulates the brain. Limit caffeine, alcohol, and tobacco before bed because that's also a stimulant. Have a bedtime routine such as a bath or soft music to get your mind into the bedtime routine. Make sure the room is conducive to sleep. The temperature should be around 68 degrees Fahrenheit, and you should have it dark with blackout curtains or an eye mask. And you can use lavender essential oils. You can spray it on your pillow to help with relaxation. You can try some breathing and relaxation exercises such as the 4-7-8 breathing technique. This is where you breathe in for 4 seconds, you hold it for 7 seconds, and then you breathe out for 8 seconds. And this will help your body relax and your heart rate decrease. If you find yourself laying in bed for more than 15 minutes, you should actually leave the room and go do a relaxing activity and come back to bed once you are sleepy. Melatonin is secreted naturally by the brain in the evening and throughout the night. You can get external melatonin about 0.3 to 0.5 milligrams. You want to take it about 1 to 2 hours before your bedtime and have it sustained release so it is released throughout the night to keep you sleeping. It is shown to improve sleep onset latency, total sleep time, and sleep efficiency. Magnesium 500 milligrams helps regulate sleep quality and helps release neurotransmitters that quiet the mind. Side effects can be diarrhea. I recommend about 500 milligrams every night. You can also try Valerian 300 to 900 milligrams. It is a sedating and anxiolytic botanical. It can take a few weeks to get to full therapeutic effect. L-Theanine is an anxiolytic and sedating amino acid. You can take 50 to 400 milligrams 30 minutes to an hour before bed. So THC increases melatonin 400-fold. Because of legalization issues, we don't have a lot of evidence base on the dose, so I would start slow and go up. Indica is a specific type of cannabis, and they say indica in the bed, so that is a more sedating option if you are looking at types of cannabis. So the same hops that is found in beer is also used as a calmative for anxiety or insomnia. You can take 1.5 to 2 grams every night. It has antispasmodic properties to reduce muscle tension and promote relaxation, and works even better when mixed with valerian. Cognitive behavioral therapy is talk therapy with a healthcare professional to identify and correct negative thinking and behaviors that are associated with sleep. It reduces people's feelings of guilt or anxiety about not sleeping and helps prevent them from staying up all night worried about not getting enough sleep for the next day. Those treated with cognitive behavioral therapy had greater increase in deep sleep and decreased wake time throughout the night than those who were treated with the medication Zopiclone. Cognitive behavioral therapy is usually one session about 1 to 2 times a week for 1 to 3 months, depending on your need. All right, that's all I have for you guys today. Comment below, let me know what has helped your insomnia. You can follow me on Instagram at Kayla Tailored Wellness. And in the description below, I do have a link to competitively priced supplements. And thanks again for watching and letting me tailor your wellness.